I'm Aimee.
I'm Hannah.
And I'm Jenna.
And our group is talking about Chapter 48, Nursing Care of Family when a child has an endocrine or metabolic disorder. The endocrine system is a group of ductless glands that work with the neurological system to regulate the body's systems. Each gland of the endocrine system acts on a specific target organ to regulate the body's processes. Location of the endocrine glands include the pituitary gland, the thyroid and parathyroid glands, thymus, adrenal glands, pancreas, ovaries, and testes. The endocrine glands produce hormones, which are secreted into the tissues in the bloodstream to control organ functions. If the secretion of hormones is altered, a variety of disorders can arise and lead to long-term aspects of care. Endocrine and metabolic disorders can change a child's growth and development, while many negatively impair social and cognitive development. There's many different types of disorders. There are pituitary gland disorders, including hypopituitarism, diabetes insipidus, and syndrome of inappropriate antidiuretic hormone. There are also thyroid gland disorders, such as Hashimoto disease and Graves' disease. Adrenal gland disorders include congenital adrenal hyperplasia and Cushing syndrome, and pancreas disorders can include type 1 and type 2 diabetes mellitus. Parathyroid disorders include hypocalcemia. Metabolic disorders also include maple syrup urine disease and Tay-Sachs disease. When it comes to assessing a child, it's important to measure the child's height and weight. Loss in weight is often the first symptom of type 2 or type 1 diabetes mellitus. If a child presents overweight, a thyroid deficiency may be suspected. It's also important to obtain a day history by asking the parent or child to describe the child's activities on a typical day. This assessment will determine a quiet child from one who's experiencing inactivity and chronic fatigue. Dietary and elimination habits are also important to assess. Extreme thirst and appetite may indicate endocrine disorder, such as diabetes insipidus. And also, it's important to assess the child's general appearance. Indication of endocrine disorders include early or late puberty, as well as changes in dry skin, drooping eyelids, poor muscle tone, and others.
For diagnostics, there are a variety of blood tests that can be used when testing and diagnosing children with endocrine and metabolic disorders. Some of the common diagnostic tests include blood tests, urine analysis, bone density scans, x-rays, CT scans, and MRIs. Blood tests and urine analysis may be used to measure levels of various hormones in the patient's body to see whether they are within range or not. If the hormone levels are out of range and the body is either producing too little or too much, it can lead to the diagnosis of an endocrine disorder. For example, the antidiuretic hormone, ADH, in the blood may be tested if diabetes insipidus is suspected. MRIs may be used to look for abnormalities in or near the endocrine glands and identify tumors, nodules, or other abnormalities on one of the endocrine glands. For therapeutic techniques to treatment, there are medications, surgery, support groups, and periodic evaluations. For medications, depending on the type of endocrine disorder and the severity, long-term medication administration is often used as a treatment option. If there is too much or too little of a specific hormone, synthetic hormones, medications are administered to correct the hormone imbalance and minimize or eliminate symptoms. For surgery, if it is determined that the disorder is caused by a tumor or an endocrine gland, surgery to remove the tumor may be necessary. If the tumor is cancerous, radiation and chemotherapy may also be needed. If children with endocrine or metabolic disorders need to continue taking a medication, either long-term or for the rest of their lives, family referrals to age-appropriate support groups are often helpful and recommended to increase bonding and build relationships with others experiencing similar situations. These support groups may help the children and family members cope with the disorder, share effective treatment plans, and successful medication administration techniques. Periodic evaluations from the children's primary care doctor and/or specialist may be necessary as the child continues to grow and develop. Medication dosages need to be altered and adjusted throughout the child's childhood and adulthood. And then for health promotion and risk management needs, genetic counseling is often recommended as many endocrine and metabolic disorders are inherited or autoimmune. And also education is an important preventative measure. For type 2 diabetes, encouraging healthy eating habits and regular exercise both at school and at home will help prevent both obesity and type 2 diabetes.
On to cultural considerations. Nutrition and physical activity is a common issue for children because nutrition impacts a child's health from conception to adolescence. Considering different cultures, nutrition varies in families because it is a learned behavior. Culture is defined as the way in which people view the world, how they interact with each other, and how they expect others to behave. Nutrition culture issues are related to the feeding environments such as food selection, the environment within which food is offered, and the relationships between the caregiver and the child. In regard to patient education, the nurse must understand the attitudes about body weight and food insecurity in families and their children. Nurses must respect and appreciate different cultural traditions among families. They must also show respect while promoting healthy nutrition and physical activity. Nurses should examine his or her own cultural influences and attitudes about their own nutrition and physical activity. Lastly, they must provide holistic nursing care in respect of each patient's cultural traditions. For example, the nurse could include foods that the patient likes, give the patient or child an opportunity to pick select foods to include in their plan of care. Holistic client-centered care plan. Some nursing diagnoses, examples for children with endocrine and metabolic disorders include risk for imbalanced nutrition, less than body requirements related to an inability to use glucose because of diabetes, disturbed body image related to abnormal height, interrupted family processes related to the child's chronic illness. Some outcome identification and planning. The nurse may help parents and children create reminder charts or set alerts for medication compliance. Smartphones are a great tool, or alarms, sticky notes around the house is also another great example. The nurse should evaluate school and home life for a child with a chronic illness. This allows the nurse to help educate the teacher or teachers and other faculty to understand the child's health problem. Some interventions the nurse could implement is the nurse needs to keep them in mind that interventions for children with endocrine and metabolic disorders must be carried out with long-term care. Offer referrals such as age-appropriate support groups to allow the child to build lifelong bonding and relationships. Share methods of medication administration techniques to facilitate successful interventions in long-term care. Continued, periodic evaluations are needed because growth and changing activities necessitate changes in medication dosages and schedules. These periodic evaluations give the opportunity for health teaching and provide them with education on new situations that may happen as they mature. Some desired outcome examples include a child brings a written record to clinic showing that she or he took her medication as recommended. Parents of a child list developmentally appropriate, not size appropriate activities for their child with a short stature. And parents demonstrate correct insulin injection technique and state they are comfortable administering an injection to their child. An interesting statistic is that diabetes is one of the most prevalent chronic health conditions among school-aged children. It is important for school nurses and educators to have adequate working knowledge about type 1 and 2 diabetes. For effective management of diabetes in school children, there needs to be an effective communication system that includes the parents, school nurse, and the healthcare provider. Successful diabetes management should address safety needs of the child, positively impact long-term health, ensure readiness to learn, and decrease the impact of diabetes-related emergencies. There are common routine diabetes care at school, such as blood glucose monitoring, insulin and medication administration, hypo and hyperglycemic treatment, and adequate nutrition and physical activity. This concludes our presentation about children with endocrine and metabolic disorders, and thank you for watching.